Hello. Hi.
Hello.
Welcome everybody to the UI Healthcare Volunteer Information Session. My name is Jean Reed. I'm the Director of Volunteer Services here. Super glad to see you all working through the onboarding to join our team. This information session is applicable to all of our volunteers, right? So whether you're community, staff, students alike, and you may be serving at the university, the downtown, or in spring of 2025, the North Liberty campus, but this is stuff that everybody serving on site needs to know. So we do have one of the largest student managed volunteer programs in the country. So over 1,000 volunteers contribute on site with us during the course of the year in our student leaderboard coordinated placements. And today we're going to begin by sharing some information about UI healthcare in general, as well as the volunteer program. Then we're going to discuss some important topics for new volunteers, and then finally address your next steps as a volunteer. And I'd like to introduce the volunteer staff. I think they're over there. They'll pop in briefly. Welcome. Hello. So Hillary Kay, you want to just give a quick introduction for everybody?
Sure. So hi, everybody. I'm Hillary Chapo. I'm the Assistant Director in Volunteer Services, and we're so excited to have you join our team.
Hey, I'm Kay Roddy. I'm an administrative specialist here in Volunteer Services, and we are very excited to have you here.
Yes, that's awesome. So the three of us are the professional staff here in the Volunteer Services office that are dedicated to supporting you, the volunteer team. We're here on the 8th floor and look forward to seeing you in the future. And do stop up. When you're here volunteering during your shift, we always have snacks at the desk, and we encourage you to stop in, say hello, get a snack. And just a reminder too that the staff here all are the folks that read those emails, right? So that UI volunteer services at uiowa.edu, that inbox is our responsibility. So awesome humans who care about you are reading that and responding. So thank you both.
Awesome.
Thank you.
Welcome.
And then I'm going to introduce Emma, who you see on the screen there. Emma is our college student leaderboard chairperson, so the highest leadership position in our program here. Emma is a volunteer, first of all, and is my VIS partner today. She's volunteered over 600 hours here, which is very impressive, right? I think about that for an undergraduate in the time that they're here, in a lot of different service areas. So in the adult acute care unit, the neonatal intensive care unit, and in leadership roles, including on our student leaderboard, now as the chair, again, the highest leadership position in the program. And she is the one that's going to review some of the basic information that you need to get started. So Emma, take it away.
All right. Thank you so much, Jean. And again, welcome to our volunteer information session. We're so excited to have all of you. There's quite a bit of important information we'll be discussing, but all of this information is also located in your volunteer handbook. You can go find this document online, and it will be one of your go-to resources as a volunteer. I will not be going through the handbook word for word. We'd be here all day, but instead you will read through the handbook independently and complete a quiz to verify that you have read and understand its content. We're going to start by discussing our hospital program and mission. Just how are we different from other hospitals or nursing homes where you have previously volunteered? A little background on UI Healthcare. We're one of the largest university-owned teaching hospitals in the United States. We provide tertiary or highly specialized care and embrace our role as a collaborative, comprehensive healthcare center, receiving referrals from physicians around the region and country. We have over 14,000 team members, which is a lot. In 2023, our clinical enterprise included 1,195 staff physicians and dentists, 570 resident physicians and dentists, 213 fellow physicians, 5,333 nurses and nursing staff, and more than 6,800 additional staff members. Our volunteer corps supplements our staff in providing the finest healthcare possible and makes our patients' lives more pleasant and comfortable. We performed tens of thousands of procedures. In fiscal year 2023, we recorded more than 33,000 inpatient admissions and over 52,000 emergency department visits. We performed over 36,000 major surgical operations and more than 190,000 minor ones. Finally, last year, we offered over 1.2 million clinic visits here in Iowa City and across the state. The mission of volunteer services is to improve the experience of patients and families at UI Healthcare. Essentially, our goal is to provide helpful services in support of our patients, family, and staff, as well as ensure quality volunteer experience for each member of the program. Like Jean said, in a typical year, we have over 1,000 volunteers donate 100,000 hours of service in over 100 different placements. Perhaps 800 or 75% of our volunteers are students prepping for healthcare sciences. Volunteer Services also oversees the retail businesses and donates hundreds of thousands of dollars to funded programs that benefit UI Healthcare patients and families. More information on that can be found in the handbook and on our website. All right. Throughout our program, we have fantastic leadership opportunities, one of which is the Student Leader Board. This board consists of approximately 18 student volunteer leaders who have a strong commitment to service at UI Healthcare. These members are responsible for coordinating the 500 plus college student volunteers contributing hours throughout our hospital each semester. The SLB member serves as a liaison between the Volunteer Services Office and the supervisory staff assigned in their area. They are a facilitator and manager for college student volunteers, serving to make the volunteer experience both more enjoyable and worthwhile. SLB members attend monthly board meetings, build relationships with their staff volunteer supervisors, coordinate trainings for their volunteers and mentors, and administer the volunteer schedule for their unit. Most volunteers in our program have either an assigned student leader board member or a community volunteer lead that serves as their point of contact. Unit mentors are another leadership position within our program. Mentors are expert volunteers within their respective units who have demonstrated reliability, good communication skills, and a strong record of service. Mentors are selected by joint decisions between the student leader board members and the staff volunteer supervisors on the unit via a formal application process, and the mentors serve on a semester basis. Due to the wide variety and functions within each unit, mentor roles can change from one unit to the next. Oftentimes, mentor duties involve working one-on-one to train new volunteers to the unit, answering volunteer questions, orienting volunteers to the hospital layout, demonstrating successful patient interaction, that's a big one, and visiting skills, and providing the SLB feedback about the unit. Mentors play a vital role in our program. I'm sure many of you watching this video will become our future mentors and student leader board members. As in the case of the student leader board applications, the mentor application is available on our website along with more information about this leadership role. If you have questions or are interested in this, please contact your unit SLB member. If you have any questions throughout this video, please go back and read through the communications you have received from the Volunteer Services Office. Then check the volunteer handbook for the answer. If you're still unsure, you can reply to your last email or email the Volunteer Services Office directly at volunteerservices@uiowa.edu. Now that we have covered a little bit more about our program, this is a great breaking point in the video for those of you who would like to watch this video in segments. Our next sections will cover patient confidentiality and privacy. All right, if you took a break, welcome back. If you're not, we're going to keep trucking. Now that you have all the information about our protecting privacy can take many forms. Simply the fact that someone is a patient here is an issue of confidentiality, and you are responsible for maintaining it. During your time at UI Healthcare, you may hear more about the Health Insurance Portability and Accountability Act, commonly referred to as HIPAA. This is a federal regulation enacted to enhance the security and privacy of protected health information. HIPAA designates civil and criminal penalties to be imposed for confidentiality breaches, which means you personally can be held responsible and fined if you share protected health information outside of what is required to perform your volunteer duties here. Most potential volunteers have a good understanding that any health information you come across here at the hospital, say from filing charts or working in clinics, is private and should not be discussed outside of what is required to perform your assignment. But let's say you're out delivering flowers one afternoon and you have an arrangement sent to the coach of one of our sports teams or some other exciting public figure. Obviously, it's pretty exciting, and the first thing you might want to do is tell a friend who you delivered your flowers to, or post it on Facebook. But would that be appropriate? Protecting the confidentiality of our patients means that we keep both private and specific information and the fact that they are patients here, all private. Protecting confidentiality can be as simple as turning a chart upside down during transport so the patient's name is not visible. Protecting patient confidentiality is very important and is something that hospital volunteers need to be thinking about all the time. The term PHI is frequently used in HIPAA and is a term that you should become familiar with. PHI refers to protected health information. That is private information that you see, hear, or say that must be kept confidential and can only be used or disclosed for specific purposes related to a patient's treatment and payment for or the operations of the healthcare organization. Anything that can be used to identify a patient that relates to their health information qualifies as PHI. Examples of PHI are listed here. As you can see, even a patient's name is individually identifiable and therefore protected under the HIPAA Act. Please review the Iowa Healthcare Privacy Notice linked in the Volunteer Handbook before you return to volunteer at our hospital. This brochure is given to all patients at our institution and reviews our policies on the uses of protected health information and patients' rights. It also offers contact information for questions or complaints regarding these issues.
So Emma, I'm going to jump in here and just add a couple comments. So you've just moved to that next slide. And I think it makes sense, right? For a lot of this. Think of it like your social security number. Hopefully when we ask you for your social number to run a background check, you think a little bit about, should I really share that? And is it secure? So that's one of the things that's listed there. But then if you go along there, also a telephone number. That does not maybe seem the same, right? But when it's protected health information, we're going to treat that patient's telephone number, which could be personally identifiable, just like you might treat your social security number, right? So just a little bit different way of thinking about things. Thanks, Emma.
Thank you, Jean. All right. Now, I realize that we've been talking quite a bit about confidentiality, and I hope that you can appreciate, as Jean said, why, but a few simple reminders can go a long way. So how does this specifically apply to you? First, only access a patient's information if you need it to do your job. Second, never share a patient's information with others unless it is necessary for your job. This means not talking about a patient with friends outside the hospital or with other volunteers or with anyone unless it's absolutely necessary to perform your volunteer duties. Finally, never put any protected health information in a trash can. Even if the piece of paper contains one patient's name, it is protected health information and needs to go in a confidential container for shredding, not an ordinary trash can. Protecting patient confidentiality is one of your most important responsibilities as a volunteer here. If you have questions, please ask your student leader board member for your unit or any member of the volunteer services staff or your volunteer supervisor. Please remember that PHI does not have to be written material. It can be a photograph posted on Facebook, Instagram, Snapchat, or other social media sites, which leads me to our technology guidelines. To maintain a professional environment, personal cell phone use should be restricted to patient-focused apps, such as the Epic Secure Chat system. Your student leader board member will tell you a lot more about this if it's applicable to your unit. But the most important thing is do not take photos in the hospital or post any information about patients on social media websites. We do have a mantra that we follow here, and it is what you see here, what you hear here, and what must remain here when you leave here. It's a little bit of a tongue twister, but it's a good way to remember it. We kind of have a little method to ensure that we keep patient information private. And we know that a lot of you are going to have some really cool experiences that you're going to want to share. I know I often go home at the end of a volunteer shift and want to tell everyone all about what I did. However, we need to keep our patients safe, and we use the policy called Scrub the Story. This involves removing any identifying information from your experience with a patient. There are obvious identifiers, like Jean said, like names, birthdays, and experiences that are specific to the patient that should be left out of your story. But we also must be mindful that UI Healthcare treats patients with really unique medical conditions. Sometimes referencing a condition or a type of treatment is enough to identify a patient. Before sharing your story, remember to scrub the details, but keep all the amazing things that you experienced included in it. Next, I need to address hospital safety and standard precautions. There's more specific information in the handbook, and additional information is provided when you have your position-specific training. But today, I especially want to point out, remember to always wear your photo ID badge. I've got mine here with my freshman year picture. It's lovely. It has numbers on the back to dial within the hospital for code blue, code green, and fire right on the back. One of the most important things to remember is do not call 911 when you are in the hospital. I know it's a gut instinct, but it's much faster and safer to use one of our house phones in the hospital and dial the extensions on the back of your ID badge. Safety reference cards, which offer even more detail about safety issues than can be found in your handbook, are available in the handbook and in the volunteer services office, as well as in your binders on your specific units or sites of volunteering. We also have standard precautions that are set out by the Center for Disease Control and Prevention. They have put these in place to minimize the risk that healthcare workers will catch an infection from a patient or spread infection among patients. Standard precautions cover blood or any bodily fluids. They must be observed with all patients at all times, regardless of age, gender, diagnosis, or whether they are under isolation for a specific disease. A good rule of thumb is if it's wet and it's human, don't touch it. You should practice standard precautions before and after each patient contact. One thing we like to say is foam in, foam out when referencing to the gel hand sanitizer pumps located outside of every patient room. So when you enter the room, foam in. When you exit the room, foam out. These are all the times when you should perform hand hygiene. Please remember that every time you cross the threshold of an inpatient room, you need to sanitize your hands. Again, foam in, foam out. We can't say it enough. In addition to using hand sanitizer, you should be washing your hands. It may seem like a simple thing, but hand washing is the best way to protect yourself and others in the hospital. You should wash your hands with warm water and soap before and after all patient contact. Jean is going to demonstrate what this looks like.
So, I mean, it's all about habits, right? Getting into good habits. If you're already in healthcare, you know, you're used to following these guidelines. If you're not, my challenge is going to be the next time you come to the hospital, you're going to wash your hands on the way in, you're going to wash your hands on the way out. And to do it correctly, is longer than most people think, right? So I think we talk about in the handbook, the minimum 15 seconds, between 15 and 30 seconds, you know, that's not scrubbing you into surgery hand hygiene, but it's longer than you think. So Emma, do you have a little second hand there somewhere? You're going to be able to keep me honest. Okay.
Yep.
So you're going to start with the warmest water that's comfortable to you, and I'm going to just show you the motions, right? Because it's important that we get that hand soap onto all the areas, under the fingernails, the thumbs, the wrists, the backs of the hands, the nail beds, all of those surface areas. And friction is super important in the effectiveness of hand washing. So how close am I, Emma?
Got 19 seconds.
Okay, so it's longer than you think. I think that's the point. We talk about the hand sanitizer. So using soap and water when you come, when you leave, every time after you use the restroom, oftentimes before you're handling food, it's not always going to be convenient, right? And just like we're talking about, every time you cross a threshold, when you're on an inpatient unit, that's a lot of hand hygiene, right? So you're going to use those pumps that are outside the door almost all the time, right? When you go into the room, a pump of that sanitizer, exactly the same motions that I just demoed, right? If you get all of those surfaces damp with the hand sani, as soon as your hands are dry, you're good to go. But sometimes it doesn't necessarily seem intuitive, right? So if you don't touch anything in the room, why do I need to use hand sanitizer on my way out of the room? And it goes back to habits. It goes back to habits. That hopefully before too long here, you won't even think. You won't even have to think about, you just know when you walk by, you're going to use the hand sanitizer, because if you don't have to remember, that's the best way to get into 100%, is just having it to be automatic. So thanks.
All right. These are the current isolation and infection control signs that are currently in use in a number of units at UI Healthcare. These may look different when you get started volunteering because they're updated periodically, so make sure that you refer to information presented to you at your unit-specific training. These signs identify what measures need to be taken to decrease the risk of spreading germs when patients are either suspected or known carriers of contagious germs. What you need to remember is always stop before you enter a patient's room and read what is posted on the door. It is your responsibility to watch for these signs. Then only enter a room if you are trained to do so and you understand the noted precautions. Note that gloves do count as PPE, or personal protective equipment, and you need to be trained on how to safely put on or remove them if it is needed for your unit. I also wanted to remind you of our volunteer guidelines and talk about tasks that volunteers should avoid doing. These mainly are for your own safety as well as patient safety. Please never give a patient medication under any circumstances. Do not give food or fluid, even water, to a patient without checking first with the nurse on duty. Don't push a patient on a cart, turn a patient in bed, or remove a patient from bed unless you have been trained and are assisting a staff member with these tasks. Take a patient, please also do not take a patient off a nursing unit without permission from the nursing station, and also do not come to the hospital if you have a cold, rash, or infection. At this time, it is a great opportunity to take a break. Next, we will cover volunteer performance expectations and conduct. All right, welcome back. We're now going to discuss volunteer performance, expectations, and conduct. Please review the professional appearance policy in the final pages of your volunteer handbook. We ask that you wear a uniform while you volunteer. The most popular uniform is with students tend to be the polos and khaki pants. I've got one on right here, has our little logo right in the corner. Furthermore, please, no denim or fleece of any color is permitted to be worn by staff or volunteers. However, you are welcome to wear long sleeves underneath your polo or a cardigan as long as the logo is visible. Polos are for sale during regular business hours in the Wild Rose gift shop. Before you purchase, however, check with your SLB to see what is required in your unit. The hospital is utilizing color-coded scrubs to help patients identify members of their healthcare team, and volunteers in our volunteer polos serve the same purpose.
Thank you, Emma. So our hospital is nationally recognized for excellent clinical quality and innovative medical expertise. In addition to our medical competency, it's important for us to be known for our courtesy and our compassion. All of our staff and volunteers need to be focused on customer service and recognize the important role you can play in the patient and family experience. In order to take these efforts one step further, we partnered with the Disney Institute, this is many years ago, to create a service excellence program for staff, faculty, and volunteers. We called it the Iowa Experience Excellence Every Time. And it's really about the personal relationships that you will all have an opportunity to cultivate here. From the attention that we pay to our environment, how does it look? How does it feel? How does it smell? The flow of our processes, the efficiencies we implement to do the task is important, but what's the purpose behind the task? That's the important piece, right? The purpose behind the task. Focus on the purpose, not the task. That's what makes all of us caregivers, regardless of our role. Caring with our minds, our hands, and our hearts. I think it's easy when we're busy to get more focused on the thing we're doing than on the person that we're connecting with. So it's just a good reminder, right? Take the time As a volunteer, I think ask, is there anything else I can do for you? I have the time. That can first of all, you're gonna have that volunteer hang tag on your badge, and I think that's also a signifier, right? I have the time. Our patients have such respect for how busy our caregivers are that oftentimes even the simplest things, which our staff would be happy to do, but they don't want to be a bother. They don't want to be a burden, so they don't mention it. And I think, again, when our volunteers are entering into that care environment, is there anything else I can do for you? I have the time. You may be surprised at the very small gestures that can make a big impact when folks aren't able to take care of things themselves like they might like. Keep your eyes open for opportunities to connect and engage with our patients and families that may be outside of your general unit descriptions. Wayfinding, I think, is one of the best. Almost any volunteer position that you have here, if you spend a little bit of time at the beginning or the end of your shift, or during your shift, helping in the hallways, those interactions can be as meaningful as anything in your assigned task list for the day. You can always dial 101 from a house or help phone. I feel like that's one of our best kept secrets. You don't need to know your way around the hospital. It's a big place. It can be intimidating for our volunteers, just like it is for staff, any new person, right, that comes through. But just remember that it's not knowing where everything is. That's the important part. It's the connecting and a willingness to make a connection that really makes a bigger difference. And then you can always reference our information desks. That 101 is you can dial from any house phone along the hallways, but the information desks also have great resources that you can check out when you're here. Please keep in mind, many of our patients come from across the state, right? So most don't take elevators on a day-to-day basis. They can be tired, worried, just stressed out from the environment here. And I think it's easy for us, once you've been here for more than just a little bit, it's easy to take for granted things like the parking, the traffic, parking ramps, elevators, all those things. I think elevators are the greatest opportunity to break the ice here. Just be willing to make eye contact and say hello. Just a smile makes a difference. You can think about how you want to start conversations. I guess all of this is really about setting you up to be the most successful volunteer that you possibly can be, right? And being prepared to start conversations can help you to be confident in doing that when you're here. So you can say hello, or I hope your day goes well for you here. I really encourage you, be your most outgoing, authentic self when you come to the hospital, right? I think we give you ideas about what to say. It's not that we want to script your behavior. It's that we know that if you have practiced and have some ideas of things that you want to say to start conversations or to close conversations, both, right? That you're going to be much more likely to have confidence to initiate and have successful interactions. So we have a few examples here on this slide. They happen to be my favorites, but everybody has different favorites, right? So some examples of things to start conversations. Is this your first visit? Have you been here before? Are you from around here? I like both of those because they give me information about where that person is, right? If this is their first visit, if they've never been to our hospital before, I'm going with them, right? The first visit can, it just really can be overwhelming. If they haven't been here before, I'm going to stick with them. And I know that the kind of help that person needs or support might be very different from, sometimes you get the response, is this your first visit? Oh, no, I've been here for weeks. Right? Or I'm a frequent flyer. I come here regularly for whatever health concern I have. And then that also tells me something, right, about where they are. Maybe they need some diversion, right? I'm going to try to think of something that maybe they haven't seen or done while they've been here. And the same thing, are you from around here? When I ask that question, if they say, oh yeah, I'm here from Iowa City or Cedar Rapids, or, it's a different kind of experience than if they tell me they're from some small town that I've never heard of in Iowa, and I've heard a lot of towns by now. Again, it's a very different experience, right? To come to this big facility from a small town. And they're going to need a little bit different support. For the closer, out in the community, you might be very confident in having you might chat everybody up in the line at the grocery store. But what you say in the grocery store might not be, your go-to here. Have a nice day. You don't know what's going on the other side here. So have a nice day is maybe not gonna be your go-to. What will your closer be? I like take care. I use take care. I hope things go well for you. Again, it's just kind of setting you up to get your mind, your head in the game, I guess, for those kinds of interactions. You're going to have many opportunities to connect with patients within your role in your unit placement. We talk about the Iowa greeting, using that with every interaction you have here, a nod and a thanks, acknowledge and greet. Hello, my name is Jean. I'm a volunteer. I'm here to, whatever the task is that brings you into that care environment. And then, talking about the anything else you can do. Is there anything else I can do for you today? I have the time. And then finally, be sure to thank them. And I think that's the piece that maybe is the least comfortable for volunteers sometimes. And again, we don't want you to feel awkward, but a thank you is just such a nice closer for me. I always say thanks for letting me visit with you today, because I truly, it's a privilege, right? They don't have to let you into their environment, and it is a privilege, and I feel that that feels very sincere to me. Thank you for letting me. It was a pleasure. Thank you. It is really a nice closer. So there are a lot of things that you can do for the patient when asked, right? We've got some of those things listed there. You'll hear more about this at your unit training. A lot of things are just very simple, quick, and easy ways that volunteers can help make a difference here. Moving a call light, a bedside table, telephone, out of reach, very common concerns, right? I think sometimes people are intimidated to answer a call light, and thinking that the patient's going to want assistance with something that you can't do. But the worst thing I feel like is if I'm laying in a bed and I can't do something for myself and I've called for help, and I see somebody walking by my door with a badge on that doesn't come to help me. So maybe it will be something that you can't do, in which case you can say, I'll let your nurse know. But there are so many things that those call lights are activated for that volunteers can help with. Just again, things out of reach. Just imagine how difficult your life would be if you couldn't just get what you wanted. Adjusting the TV. The TVs are really challenging in some of our areas to figure out. So adjusting the room lights, things that you can do, get blankets, pillows, just a wide variety of things. I think that's all that I had listed here. Emma, was there anything else that you think we want to cover in this section? It's really about confidence, being comfortable, and again, focusing on those caring interactions. We know that most of you, that's your driver, right? That's what you're coming here for. You want to practice having patient interactions, building rapport. We know from our feedback that's a huge driver here for our community volunteers. It's, you want to have that one-on-one, face-to-face interaction with our patients and our families. And just a little bit of preparation, I think, can go a long way to helping those first interactions, especially once you get started walking into that room, or walking onto that elevator and breaking the ice and making the difference and seeing the relief in the eyes of the folks that you're chatting with. You'll get hooked.
Mhm. Definitely, for sure. Like Jean said, sometimes the patient might ask you for something that you don't know or you're not sure you can do for them, and that's okay. I remember as a first year volunteer being like, oh, I'm sorry, I'm not sure. But my favorite thing to add on to the end is, but I can find out. And that's your goal at the end of the day, is they're asking you, you might not be able to do it, but you can find someone who can, even if that just means ducking out in the hallway and grabbing a nurse and being like, hey, I'm just really not sure about this. They can kind of take it from there and see what's going on. And another thing that you can do for patients that isn't so much of a task is sometimes patients just need a visitor. I know a lot of the units I've been on, sometimes patients are there for weeks, if not months on end. A lot of them may not have daily visitors or visitors at all. Sometimes just going in, and if you can start a conversation, they'll just chat your ear off for your entire shift. And those have honestly been some of my favorite shifts, because you really get to know those patients. You come back week after week and see those same patients. But then there's also the patients that you may only see once. And that's being able to make that connection with them for just a short time is really important too. And that's, I think, why a lot of you are here, and is definitely my favorite part about being here. So the tasks are obviously important, but don't get so distracted by those that you forget that there are people who need to be talked to on the other side as well.
You know, and I would say that honestly, patient visiting is the priority, right? We have lots of, to Emma's point, there's lots of environmental and other activities that we participate in, but the priority is always going to be the patient visiting, patient interaction.
All right. Now
Want
that
me
we've
to take this one, or do you take this, Emma?
This one's yours. My bad.
Either's fine. So, yeah, now it's just next steps, right? We've covered some of the basic information that you'll need as a new volunteer. Lots more information in that volunteer handbook. Again, that volunteer handbook is your go-to resource. Months down the line, you might encounter something, a question. That's always going to be your first, the gold standard for FAQs. You need to keep open communication with the volunteer services office, right? Your staff volunteer supervisors, your student leader board member, community leads, all wonderful contacts, should you have questions or concerns. Check your email, right? The onboarding process is kind of, I talk about it a little bit like a ping pong game. Here's this that you need to do, and you send that back, and then we send you something, and then you send us something, and it goes back and forth until you get to the badge, and all of the program updates, the guideline changes, important information are going to come from our office and emails. Once you're an active volunteer, you'll get a weekly engagement message. It's really important that you're reading these communications and stay up to date. Again, if you have questions for the staff, you just email volunteerservices@uiowa.edu. Sometimes, I wish it weren't the case, but we are dealing with hundreds, thousands of people, and tens of thousands of communications, and sometimes our processes, a ball gets dropped. Reach back out to us. If you have not heard back, if you expected to get that ping pong ball back and haven't heard from us, or if you've asked a question and hadn't got a response, in 5 business days, follow up again. You shouldn't have to do it, but that is, it should never take us more than 5 days, even in our busiest time with our highest communication. Even if we have staff out, 5 days is, so if it's been that long, please reach back out as a reminder for us. Again, review your previous communications from our office. A lot of the questions that we get, we're just referring you back to an earlier communication that we sent as far as specific information. I think, yeah, it's a checklist that you're just going to be working through. And if you have questions, just send us an email. Sometimes people prefer to call, but we aren't usually going to be able to answer your question on the phone. And a lot of times the people on the phone are going to say, so our receptionists are volunteers at the desk, right? They're going to suggest that you email, because the staff check the email and then can get into your personal record and can get the information that is really going to answer your question, and we'll have a record of it then. A reliable weekly record. Yeah, is dependent upon communication with staff and reliable weekly service. So when you've served 40 or more hours of your volunteering commitment, so everybody, students and community volunteers alike, the minimum commitment here is 72 hours. The only difference is really the attendance expectations. So for community volunteers, it's 6 months of weekly service. Whether and then for student volunteers, it's tied to the academic calendar. So when classes aren't in session, you're not required to volunteer. So that would be, Thanksgiving break, spring break, winter break. You can take summer if you're not in Iowa City. That would be considered not part of the regular academic calendar. So it's a different consistency expectation, but the total 72 hours at 3 hours a week is the same for everybody in the program. Like I say, at 40 hours or more, we're able to provide you with an hours confirmation for application, basically saying you're making good progress to your commitment. At the minimum 72 hours or more, you can request a more personal letter of recommendation, the type of recommendation that professional grad school usually is going to require. So when you get to that point, you can contact our office. So just kind of a reminder, we have phenomenal choices here, right? And for our students, our community volunteers alike, I always encourage folks, get out there, try some different things, right? We encourage our student volunteers. We make it easy for our student volunteers to pick new placements each semester. For our community volunteers, I'm like, you could pick a new service area every 6 months for 10 years and still not see half of what we have to offer here. It's phenomenal. We have so many terrific partnerships that we support, and we're able to secure that, all of those varied and interesting placements because of long-term responsible volunteers, right? Our staff know that they can count on when our students get started at the beginning of the semester, they know that they're going to be there through that semester. When our folks get started here, it's a complex environment, and for our team to be interested, no one has to partner with volunteers, right? But they're all choosing it because of the reliable nature of the team that we have here. So keep that in mind. Also, for new volunteers, you may not get your first choice of volunteer placement your first semester, right out of the gate. So the good news is that all of our placements offer you patient experience and the opportunity to make a difference at our hospital. And the returning volunteers have priority for open placements. So next semester, when you have more hours, you're going to select your shifts before the new volunteers. And finally, it's really important that you record and report your volunteer hours accurately. Your unit binder is going to be the way that most of you will do that. If you have a student leader board member, then your board members turns in those timesheets monthly to us. But it is your responsibility to make sure that that information is accurate and recorded. The hours that our volunteers record are the only source of data for records that we supply to SLB, to unit staff, hospital administration. It's how we show our efficiency as a department, and the impact that we can make, right, with our patients. And it's also the sole method by which we make recommendations and references for you. So you can always check in our office for your current volunteer hour total. It's really easy on our touch screen. So when you come up and grab a snack, you can check your hours on that touch screen and make sure that it's as you would expect. More information on that, how to record your hours, is going to be covered in your individual unit training. So different areas have different expectations for that. And you'll learn more as you move through. But basically, I just want to impress upon you that even if it's not important to you, sometimes people are like, I'm not doing it for the hours. We know you're not. But it is important for a lot of other reasons.
All right, guys, you've made it to the end. Congratulations. And welcome to your journey into our volunteer program. I promise you have a lot of exciting things ahead of you once you get through our onboarding process. Never thought I'd be here 3 years later, but here I am. And I just really feel like this quote by one of our team members, her name's Peaches, I think she really just sums up what we're all about. And why we all want to be here. And she says, and remember that whatever your volunteer role at the hospital, Every day, you will have the opportunity to make a difference for our patients and their families and for each other. And I think that really kind of sums up what we do here. Obviously, our patients and families are at the forefront of our goal as volunteers, but also for each other. You're going to make some amazing relationships through the volunteer services program. You're going to meet other students, staff members across the hospital that you're going to make connections with that will definitely help you in the future and make your experience more enjoyable. But as we close, thank you so much for watching, and we look forward to helping you make a difference by volunteering at UI Healthcare. We'll see you later.
Thank you, Emma. Thank you, everybody. Look forward to seeing you soon.